Imagine you start feeling constant fatigue, frequent headaches, and unexplained bruises on your body. You might attribute it to stress or lack of sleep, but what if these are symptoms of something much more serious? Hi, my name is Doctor.Global. Let's talk about leukemia. You might be surprised to know that the umbrella term, blood cancer, includes over 150 different types of cancer. Each has unique prognoses, symptoms, and courses of treatment. Over 1 million Americans either have blood cancer or are in remission from it. Cancers that originate in the bone marrow or the lymphatic system can be categorized in a variety of ways. Let's examine the most prevalent blood cancers in each classification. Leukemia is a type of blood cancer that starts in the bone marrow, the vital organ responsible for blood cell production. It's characterized by the rapid growth of abnormal white blood cells, which can crowd out the normal red blood cells, white blood cells, and platelets the patient's body needs to function properly. Leukemia's classification is based on how fast it progresses into acute or chronic and the type of cells involved into lymphocytic or myelogenous. In acute leukemia, immature abnormal cells rapidly increase, making the bone marrow unable to produce healthy cells. This disease progresses quickly, requiring immediate and aggressive treatment. In chronic leukemia, the abnormal cells are mature. These blood cells build up slowly, taking months or years to progress. Lymphocytic leukemia affects the lymphoid cells, which form the lymphatic tissue and make up the immune system. Myelogenous leukemia affects the myeloid cells, which produce red blood cells, white blood cells, and platelets. The specific types of leukemia are acute lymphocytic leukemia, ALL, can occur at any age but is most commonly diagnosed in children, with a peak incidence between ages 2 and 5. Acute myeloid leukemia, AML, progresses rapidly and can affect different types of blood cells. It is most common in adults, with a median age of diagnosis around 68 years, but it can also occur in children and adolescents. Chronic lymphocytic leukemia, CLL, is the most common form of leukemia in adults, primarily affecting older individuals with a median age of diagnosis around 70 years. For chronic myeloid leukemia, CML, slowly progressing and affecting myeloid cells, CML accounts for about 15% of all leukemia cases and primarily affects adults. Causes and risk factors. Leukemia occurs when some blood cells develop DNA mutations. Risk factors that may increase the likelihood of developing leukemia include genetic disorders, such as Down syndrome, significantly increase the risk by 10–30 times more than children without this condition. High levels of radiation are significant risk factors. For example, radiation treatment for other cancers can increase the risk later. Exposure to chemicals like benzene is linked to leukemia. Smoking, current smokers have a 40% higher risk of developing AML than the general population. Leukemia symptoms can vary, but generally, patient might notice fatigue and weakness, caused by anemia from a lack of red blood cells. Frequent infections, due to insufficient healthy white blood cells. Easy bruising and bleeding, resulting from a low platelet count. Bone or joint pain, caused by the spread of leukemic cells. Swollen lymph nodes, liver, or spleen, due to the accumulation of leukemia cells. Unexplained weight loss, a common symptom in many types of cancer. Fever or night sweats, indicative of the body's response to leukemia. Diagnosis. If leukemia is suspected and the patient presents with the symptoms, several tests can confirm the diagnosis. During a physical exam, a doctor will check for signs of leukemia, such as pale skin from anemia, swollen lymph nodes, and an enlarged liver and spleen. Blood tests. A complete blood count can reveal abnormal blood cell levels and immature cells called blasts. Bone marrow aspiration and biopsy. Samples from the hip bone marrow are examined to confirm the diagnosis. Cytogenetic analysis. This test looks for specific genetic abnormalities in leukemia cells, such as the Philadelphia chromosome in CML. Treatment. Treatment methods depend on the type and stage of leukemia, the patient's age, and overall health. Leukemia is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, procedures such as stem cell transplant or allogeneic bone marrow transplantation can cost twice as much in UAE and China as in Turkey and Colombia, but half as much as in Germany and Israel. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. A variety of therapeutic options are available for different leukemia types. Chemotherapy is the primary approach for treating leukemia. Different combinations of drugs killing cancerous cells are used depending on the cancer's stage and type. Targeted therapy focuses on specific abnormalities in cancer cells, causing them to die. Leukemia cells are tested to determine if targeted therapy might be effective. These drugs have significantly improved the prognosis of leukemia. Radiation therapy uses X-rays or high-energy beams to destroy leukemia cells and stop their growth. It is indicated in specific situations, such as when leukemia has metastasized to the brain or testicles. Stem cell transplantation is performed for high-risk patients not responding to chemotherapy, those with recurrent or aggressive leukemia, and young patients. It replaces diseased bone marrow with healthy stem cells. Before this procedure, patients receive high doses of chemotherapy or radiation to destroy leukemia-producing bone marrow. Immunotherapy uses the patient's immune system to fight cancer. Immunotherapies being used or studied to treat blood cancer include: CAR T-cell therapy can treat various leukemias by engineering T-cells to fight cancer. Monoclonal antibodies are lab-made immune proteins that attach to specific targets, usually proteins on cancer cells. They help the immune system recognize and destroy the cancer cells. Observation: in early, symptom-free stages of chronic lymphocytic leukemia, watchful waiting may be advised. Leukemia survival rates and prognosis. According to the statistics, leukemia 5-year survival rates are the following. Acute lymphoblastic leukemia, 85% in children, 40% in adults. Acute myeloid leukemia, 29%, influenced by age, genetics, and health. Chronic lymphocytic leukemia, 83%, with many living longer, depends on diagnosis stage and genetic markers. Chronic myeloid leukemia, over 70% with targeted therapies, with many achieving long-term remission. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.